Hello everyone. Today, we're exploring the medication known as Zyvox. As always, this discussion is intended for educational purposes. If you have health-related questions or concerns, it's crucial to consult a medical professional. Zyvox, with the generic name linezolid, belongs to the class of oxazolidinone antibiotics. It is designed to combat bacteria within the body. Additionally, linezolid is an MAO, monoamine oxidase, inhibitor. Zyvox is prescribed to treat various bacterial infections, including pneumonia, skin infections, and infections resistant to other antibiotics. It's essential to note that there might be other uses for Zyvox not mentioned in this guide. Certain medications can lead to unwanted or hazardous effects when combined with Zyvox. It's imperative to inform your doctor about all the medicines you are currently taking. Avoid using Zyvox if you've taken an MAO inhibitor in the past 14 days, such as isocarboxazid, linezolid, methylene blue injection, phenelzyne, trenylcypromine, among others. Before starting Zyvox, inform your doctor about all other medications you're using. In some cases, you might need to stop taking certain medicines for up to 5 weeks before beginning Zyvox treatment. It's also crucial to avoid this medication if you have untreated or uncontrolled high blood pressure, a carcinoid tumor, adrenal gland tumor, or an overactive thyroid. If you're on antidepressants or psychiatric medications, be vigilant for signs of a severe drug interaction, including confusion, memory issues, hyperactivity, loss of coordination, muscle twitching, shivering, sweating, diarrhea, and fever. You should not use Zyvox if you're allergic to linezolid. Ensure you inform your doctor if you've ever had high blood pressure, a thyroid disorder, a carcinoid tumor, bone marrow suppression, a weak immune system, kidney or liver disease, pheochromocytoma, adrenal gland tumor, diabetes, seizures, or if you use a catheter. If you're pregnant, planning to become pregnant, or breastfeeding, consult your doctor. The oral suspension of Zyvox contains phenylalanine, which could be harmful if you have phenylketonuria, PKU. Always use Zyvox as prescribed by your healthcare provider. Zyvox tablets or oral suspension can be consumed with or without food. The injection form of Zyvox is administered as an infusion into a vein. It's essential to follow all directions on your prescription label and any accompanying medication guides or instruction sheets. Ensure you complete the full prescribed duration of the medication, even if your symptoms improve rapidly. Not completing the course can increase the risk of developing a medication-resistant infection. Like all medications, Zyvox can cause side effects. Some of the common side effects include nausea, vomiting, diarrhea, skin rash, anemia, headache, and dizziness. More severe side effects can include vision problems, severe stomach pain, seizures, symptoms of serotonin syndrome, like agitation, hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness, twitching, loss of coordination, nausea, vomiting, diarrhea, lactic acidosis, and low blood cell counts. If you experience any unusual or severe symptoms, it's crucial to seek medical attention immediately. Zyvox can interact with various medications, leading to a condition called serotonin syndrome. Ensure your doctor is aware if you're taking stimulant medicine, opioid medicine, herbal products, or medicine for depression, mental illness, Parkinson's disease, migraine headaches, severe infections, or prevention of nausea and vomiting. Many drugs can interact with Zyvox, so always inform your doctor about all the medications, supplements, and herbal products you're currently using. It's vital to adhere to the recommended dosage provided by your healthcare provider. Zyvox tablets or oral suspension can be taken with or without meals. If you're using the injection form, a healthcare provider will administer your first dose and might instruct you on how to use the medication correctly. While on Zyvox, avoid consuming foods with high levels of tyramine as it can elevate your blood pressure to dangerous levels. Such foods include aged cheeses or meats, pickled or fermented meats, sauerkraut, soy sauce, tap beer, red wine, and improperly stored protein-based foods. Many individuals have questions about the dietary restrictions while on Zyvox. It's essential to be familiar with the list of foods to avoid during the treatment. Always consult with a healthcare provider for any specific queries related to this medication. That concludes our overview of Zyvox. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.